Emergency can happen anywhere, so it is important to know how to provide basic life support care. Check surroundings to ensure they are safe. Check scene safety. Part 1. Checking the situation. Tap the victim's shoulders and shout, "Are you okay?" If the victim is unresponsive and you are alone, call for help and check for breathing. Part 2. Checking for breathing. Look, listen, and feel. Number 1. Open the victim's airway. Number 2. Use the head tilt and chin lift technique. Number 3. Press down on a forehead with one hand. Number 4. Pull up on the chin with the other hand. Number 5. Listen to sound of breathing. Number 6. Feel for exhalation on your cheek. Number 7. Look to see if the victim's chest is rising or falling. Part 3. Calling an ambulance. If the victim is not breathing and there is another rescuer, ask him or her to call an ambulance. If you are alone, call on yourself. The emergency medical dispatcher will give you instruction on how to provide cardiopulmonary resuscitation or CPR. Part 4. Doing CPR. Place the victim on a firm, flat surface. Number 1. Kneel at the victim's side. Number 2. Place one hand on top of the other and interlace your fingers. Number 3. Place the heel of your hand in the center of the victim's chest on the lower half of the breastbone. Number 4. Position your shoulders directly over your hand. Keep your arms straight and lock your elbows. Number 5. Compress the chest 30 times to a depth of 5 or 6 cm, then allow for full chest recoil. Number 6. Chest compression should be steady and fast, performed at a rate twice a second. You can even count if it helps. Number 7. Every 30 chest compressions are followed by 2 ventilation. Ventilation is carried out using a bag valve mask or a BVM. A good breathing assistance procedure is: make sure there are no gaps between the BVM mask and the patient's face. Squeeze the bag with one hand for 1 second to introduce approximately 500 milliliters of air into the patient's lungs. Ventilation is carried out at no more than 8 to 10 breaths a minute to prevent the patient from hyperventilating. The compression ventilation ratio with one helper is 30 to 2, while with two helpers it is 15 to 2. In intubated patients, ventilation is given continuously at a rate of 1 every 6 seconds or 10 times a minute. While chest compression are performed, number 1. Repeat this sequence, minimize the interaction and chest compression to last no more than 5 seconds. Number 2. Alternate the 30 chest compression and 2 ventilation until help arrives. Number 3. If you have another rescuer with you, switch position every 2 to 3 minutes because providing CPR is tiring and you become less effective. And last, when you see signs of victim regaining consciousness, such as breathing, calming, or moving purposely, stop CPR. Stop CPR when the victim starts breathing. Put the victim in a recovery position.